Hello, I am Dr. Chandrika HS. Yes, libido will reduce after delivery, and this is natural also, and this becomes more because of the societal reasons also. The libido reducing will depend on the partner also, because so many times the partner becomes less responsive to the lady whom he is to have better relation before she deliver a child. That is one thing. Second thing, about her body also, there will be so much changes after delivery. Simple thing is, suppose you have delivered normally, that is the vagina will have become little stretched and the elasticity of the vagina will have reduced, and because of that there is reduction in libido. And one more thing is, so many times she'll have got what is called as episiotomy. That is a type of suturing that we do at the vagina during delivery, that is normal delivery. Because of pain that is involved in that area, because of that also the libido will reduce. So that is the reason we tell that the mother should go to her mother's house for some days postpartum, so that she'll handle all those things better, because she'll recover from that immediate phase after delivery, and then she'll return to her husband's house. And that usually medically at least 6 weeks is needed for the mother to get changes in her body to a certain extent. But it is better she takes a much longer gap before she enters the normal life. So this is the reason for the reduction in the libido. Well, estrogen and testosterone are very important hormones that are needed for libido. See, estrogen is a hormone which has effect on the vaginal epithelium, that is upper layer of the vagina, because estrogen is a hormone which makes the blood circulation more to the vaginal surface, and because of the improved blood circulation, the efficiency of the vagina becomes more. That is, maybe that will become more labile, more it will produce more of that secretion that happens during intercourse. And because if there is a deficiency in estrogen, this secretion reduces and there will be no lubrication. And if there is no lubrication, the act of this thing will be more painful. So the deficiency of estrogen will act like this. And one more thing is, testosterone is known hormone which promotes libido. And if there is a deficiency in testosterone postpartum, this can also reduce the libido in postpartum ladies, that is in the newly born motherhood. Breastfeeding affecting her libido is that the mother becomes more concentrating on her child. She will not be so much interested in her partner after delivery. That is natural thing that happens. That nature has made it like that, so that the baby is nurtured better. So because of that, libido reduces. And one more thing is, when prolactin increases also, there is some amount of reduction in the protein, estrogen and progesterone also, because so many times in lactational period the mother suffers from amenorrhea, that is loss of menstruation, which will happen for a few months post delivery, and this is due to the increase in the prolactin level and the fact that she is lactating. Because of lactation, these are the changes that happens in the hormones, and this is the reason for loss of libido or reduction in the libido post delivery. Yeah, mental and emotional fatigue has definitely effect on libido, because mentally if you are not prepared to have intercourse, definitely your body will not allow you to. So you will try to refuse having the act of intercourse. So this is one reason. And the fatigue also, if you are very tired, because intercourse is a very intense exercise, and if you are very tired, naturally you will not be able to do anything because you are already exhausted. So these are two factors that definitely has effect on the libido. Yeah, safe methods to reignite intimacy. So first thing is, the husband, that is the partner, should understand that my partner is facing a sudden change in her body, because of which she is not getting interested. So he has to be more helpful for her to recover. See, first thing is, so many times the mother, she is now bothering about the child, and so many families are there where there is no rest for the delivered lady, and she has to take care of the family also. Means she might have to take care of the house. That is, simple thing is like cooking, and sometimes she has to look after the cooking part also. She has to look after the child also. That time mind becomes more stressed out. Because of that, in those situations, the husband should help the newly delivered mother, so that she'll be able to take care more easily. And that if he does, she'll feel more relaxed, and that time she'll be able to be more cooperative in intimacy. And one more thing nowadays is, there are more of working mothers, and so many places in workplace, the government has made rules that they have given very much long time for postpartum recovery. That is the maternity leave. But there are some companies where they do not give proper maternity leave. So when the mother has to earn also, that becomes an extra responsibility. So when she has to attend her office also, that time she has to take care of how to reach the office, how to look after the child, who will look after the child. These are the things which will make her more worried, and these are the things that can make her more stressed out in life, and it will naturally produce reduction in the libido.